In the heart of Europe, a new movement is rising that champions equitable, diverse, and inclusive cancer care for all. Cancer does not discriminate. It affects individuals regardless of age, gender, race, or socioeconomic status. Yet access to cancer care can vary greatly. The right of everyone to access healthcare is enshrined in Article 35 of the European Union's Charter on Fundamental Rights. That's why, from the beginning of the European Network of Youth Cancer Survivors, we set on a quest to find out what challenges young people face regarding equitable, diverse, and inclusive cancer care, and produce actionable recommendations designed to be aspirational, achievable, and tangible. But first, let's ask ourselves, what is EDI in cancer care?
EDI stands for Equity, Diversity and Inclusion, and it means all the possible resources that can be done to make the cancer patient path as easy as possible in the means not only of treatment but in the means of all the psychological support. Equity stands for giving the person, giving the patient all the necessary resources that he or she needs in his or her specific case. Diversity means acknowledging their background, their cultural background, religion, sex, age, in order to have the best outcome in their path. And inclusion means to give their welcoming and supportive surrounding that they need in their cancer treatment path. And EDI in complexity gives the feeling of belonging, which is very important for any cancer patient who is going through treatment and who is facing different hardships due to different circumstances.
Equity, diversity, and inclusion, EDI, in cancer care encompasses the principles of fairness, accessibility, and respect for individual differences to ensure that all individuals receive appropriate and timely support and services to achieve optimal health outcomes. To truly grasp the urgency and impact of these issues, we must listen to the voices of those affected. 41% of young people with cancer don't feel represented by booklets and other information provided to them by healthcare facilities. 53% of young people with cancer think policymakers don't do enough to address issues of diversity and inclusion in their programs. 16% of young people reported being exposed to racially charged or dehumanizing language during or after their cancer care. Based on a literature review, online surveys, and a multi-stakeholder consultation and workshop, a set of recommendations was established to serve as a framework for advancing the development and implementation of EDI-focused policies, guidelines, and best practices.
We are hoping that EDI, equity, diversity and inclusion, will be implemented on the national levels of the countries that will stick to the recommendations made by us, not only on the healthcare treatment, medical treatment, but also like all the support, psychological and physiological and cultural support that we can give.
How to implement and improve EDI in cancer care across Europe. 1. Strengthening EDI in research, improving patient data collection, and enhancing research team diversity. 2. Improving EDI in cancer services, providing culturally sensitive care and promoting diverse representation in care teams. 3. Fostering diversity and inclusion within patient organizations. In order to deliver on these recommendations, 4 focus areas for targeted action have been defined: race, ethnicity, culture, refugees, and migrants, gender identity and sexual orientation, age, physical and mental well-being, education, career, and socioeconomic status. These focus areas are not mutually exclusive, allowing for a comprehensive approach that addresses intersectionality, recognizes overlapping challenges, and actively works to understand and meet the unique needs of every individual.
We have, again, to remember that a cancer patient is not only a patient, but is a human being who needs all the support available, like medical support and psychological support, to have the best outcome of his or her path.